Study says, cell phone radiation and mercury in your teeth cause significant health problems. Natural Health 365. Let me ask you, do you have amalgam dental fillings? Do you use a cell phone? If you do, then beware, the latest research shows that you may be particularly at risk. There's a considerable amount of research pointing to the dangers of radio frequency electromagnetic field exposures from cell phones. There is also significant research which points to the adverse biological consequences of mercury in amalgams. But what is not so well known is that research is now pointing to a link between the two. EMFs can cause a significant increase in the release of mercury into the body. Studies are now showing that EMF exposures can cause significant increases in the release of mercury into the body of those with amalgam dental fillings, especially due to cell phone radiation. But the source of these EMF exposures are not necessarily just from cell phones. These EMFs may come from computer monitors, Wi-Fi, televisions, microwave ovens and other appliances. Editor's note: 80% of disease symptoms are caused by problems in the mouth, and millions are exposed to disease-promoting dental procedures every day. Find out how to properly remove mercury-based silver fillings plus much more. Order the Holistic Oral Health Summit today. In most people who have amalgam fillings, it is their fillings that have been documented to be the largest source of mercury in their body. This is a concern because mercury is known to be a potent neurotoxin capable of causing these devastating immune and neurological conditions. Even more worrying is that often the level of mercury exposures is above government health guidelines. The nervous, immune and cardiovascular systems seem to suffer the most adverse effects of chronic mercury exposure, according to Dr. Russell Blaylock. The nervous, immune and cardiovascular systems seem to suffer the most adverse effects of chronic mercury exposure. He also points to the growing evidence that mercury toxicity plays a vital role in a significant number of Alzheimer's cases along with other neurodegenerative diseases. Research from a number of prominent medical schools shows that mercury vapor continuously escapes from a dental amalgam, and 80% of this vapor is immediately absorbed through the lungs and into the bloodstream. Once in the blood, mercury vapor can enter into the cells almost immediately. Not just vapor effects, this deadly EMF mercury combo also creates electrical disturbances in the mouth. Another way this deadly EMF mercury combo is known to work is through galvanism. Amalgam dental fillings produce electrical currents which increase mercury vapor release and may have other harmful effects. These currents are measured in microamps, with some measured at over 5 microamps. Clinical studies on oral galvanism have found that currents over 5 microamps can cause significant health problems, including headaches, migraines, dizziness and nausea. These health symptoms were eliminated when amalgam fillings were replaced. EMF exposures linked to a string of toxic and allergic reactions. Another clinical study found that electrical potential differences of over 50 millivolts were pathological, causing a number of issues including galvanism, leukoplakia, or lichen planus, or toxic or allergic reactions to restorations. Several studies have also found persons with chronic exposure to EMFs, including microwaves, or MRI scan exposures, have higher levels of mercury and higher levels of mercury excretion. A 2008 study found that subsequent to having an MRI, saliva mercury levels for patients was on average 31% higher after having had MRI than before. EMFs are known to induce current in metals and would increase the effects of galvanism. In animal and human studies, EMFs have been found to cause cellular calcium efflux and affect calcium homeostasis. This is thought to be a factor in the reduction of melatonin levels caused by EMF exposures. This is important because melatonin is known to be protective against mercury and free radical activity, as well as regulating the circadian rhythm. Tips on how to protect yourself from EMF exposures. 1. Avoid using a cell phone. If you do use one, practice safe cell phone use. 2. Avoid Wi-Fi and other wireless networks, especially in the home. 3. Replace cordless phones with corded versions. 4. Avoid using laptops and similar devices on your lap. 5. Move your bed 6 inches away from the wall and any potential wiring EMF issues. An excellent way of understanding your EMF exposures is to equip yourself with an EMF meter like the Trifield 100XC, so that you can identify hotspots and take remedial action. How to protect yourself from mercury exposures when you visit a traditional dentist. Typically you increase your risk of mercury exposure. Even a simple dental cleaning will release mercury vapor. If you are not ready to replace your amalgam fillings, find a biological dentist in your area to reduce your mercury exposure during your dental visits. If you do decide to have your amalgam fillings removed, make sure that your dentist follows a safe protocol as outlined by the International Academy of Oral Medicine and Toxicology. EMF. About the author, Lloyd Barrell is the founder of electricsense.com. His website offers solutions to the growing number of people whose health is being compromised by exposure to wireless and similar technologies. Download his free EMF Health Report today.